Hello and welcome to yet another special Facebook Live Q&A. We're here again with Dr. Nirmal Joshi. He is the Chief Medical Officer with Mount Nittany Health. Welcome, Dr. Joshi. It's great to see you.
Hi, Leanne.
Thanks for being here. So Dr. Joshi is back to provide an update on the COVID-19 vaccine specifically, a hot topic. If you have a question for Dr. Joshi, please go ahead and type it in the comments section below. We also received quite a few questions ahead of today's live broadcast, so we'll be sure to address those as well. Perhaps, Dr. Joshi, we could start by explaining the vaccine. Can you talk to us a little bit about how it works and how do we know it's safe?
Sure. So the vaccine is a very novel way, in general infectious disease terms, it's a novel way to prevent manifestations of the infection. So it's both of the vaccines, the currently available vaccines in the United States, the one produced by Pfizer and the other produced by Moderna, are both vaccines that are called mRNA vaccines. And essentially, it takes a piece of protein, and along with the vaccine, it kind of puts it together in a lipid, in a fat formulation of sorts, and that's what's administered to the recipient. Once it's administered, what it does is it causes the cells in the body to begin creating a kind of protein that is very similar in look and feel, if you will, to what's called the spike protein of the actual virus. So what that does is the body is tricked into believing that the virus is there, but in reality, it's just that protein, that spike protein look-alike that's there. And what that does is it causes the body to mount an immune response to it, by way of antibodies and by way of T cells, which are also a special form of immune defense of the body. And that process, including the antibody formation in the body, is what provides the protection for, against the virus. And that protection, as has been found, has been highly effective, which is one of the most highly effective vaccines that are out there, with an approximately 95% protection against manifestations of infection. Mm-hmm. There has been a fair amount of dialogue about whether or not it prevents infection per se. And to me, as a physician, that's somewhat less important, although it has some implications as to how we take care of ourselves even after getting the vaccine. Meaning we can still be, quote, infectious, meaning we can harbor the virus within us, even though we've been vaccinated, and not have any symptoms. So there is a potential of spread from person to person. But other than that, for individuals, almost all of the consequences of the infection essentially go away. You do not, 95% of the time, you do not get any of the consequences of the infection. And if you do, it's mild and self-limiting. It is certainly not severe.
Mm-hmm. Okay, great. Thank you for that explanation. You've answered my follow-up question, but I think it bears repeating. Can you explain to us, if you've been vaccinated and you're immune, why is it still necessary to follow COVID-19 prevention, such as wearing masks and social distancing?
Yeah, like I said, there are many reasons why that needs to continue. And one of those reasons is, so let's say I got exposed to the infection today, and I get the vaccine a few days from today while the infection is still kind of incubating in my body. So I will still have the infection, as in the virus, in my nose, in areas which can transmit infection. And therefore, I'm still likely to transmit that infection to others, even though I've now been vaccinated. So that's one. Secondly, if I were to get an infection after, or if I were to get exposed, I should say, after I've received the vaccine, even though for all the reasons that I just explained, that I would not get signs and symptoms of the infection, it is still likely that the virus might still be in my nose and my throat and so on and so forth. And I'm still capable, in theory, to transmit infection from myself to others. So it makes a whole lot of sense to be able to pursue the same kind of precautions as I would had I not taken the vaccine. Now, a certain point will come, and all of us are hoping that point is sooner than later. A certain point will come when enough of us are vaccinated, right? And this has been talked about in multiple circles. Enough of us have immunity to the virus, and there reaches a point that's called herd immunity. A certain percentage of us, right, are all immune. So the virus, as it tries to go from one to the next, simply does not find a susceptible host and effectively peters out and dies. So that's when epidemics typically stop. So that's typically how it works. But we have some ways to go before that happens. So in the interim, everyone is recommended to follow the principles that CDC has outlined, which is to continue using the kind of precautions that we always have talked about.
Yeah, great. Thank you. Makes good sense. Now let's talk a little bit about the vaccine rollout. Can you talk to us about who Mount Nittany Health is currently vaccinating?
Yeah. So and before I get into the who we are currently vaccinating, I'll just mention one thing right at the outset, because I think I've gone through some of these myself as a consumer for my family members who are not healthcare professionals, but who we as family members of them have gone through some of the same difficulties that many of our community members are going through. So just so you know, we hear and understand what those how helpless it feels not to be able to get the vaccine and be in line and a long line at that, not to be able to get vaccine, particularly when you're in a high risk category. My mother-in-law, as an example, is above the age of 80 and has multiple comorbidities. And it was a while before we could find an appropriate way to get her vaccinated. She's in a different community than State College, but it was a tremendous effort and to try to figure out multiple places as to how we could get her vaccinated. So I can completely understand. Now, what I will say is what we are attempting to do is to do the very best we can to get as much of a vaccine supply that we can from the Department of Health, which in turn has its own allocation from the federal government, as most of you know. So what's been happening is that we have, as a health system, taken ownership of ensuring that we take responsibility for our community. Now, that's something, as I'm sure you'll understand, in the middle of a pandemic where all of our efforts were hunkered down in the hospital to take care of people who were very, very ill, has been extraordinarily difficult, as you might imagine. And in the middle of all of that, we took on ownership, as we would with a certain pride, like Mount Nittany has always done, that we took ownership of attempting to take community responsibility, whether or not people were employed by us, whether patients were taken care of by us. Like a good citizen and being the sole hospital system in our community, we began to take ownership of vaccinating our community. Now, that's the good part. The problem is, which I think is very important to say at the outset, whatever methods or processes that we're developing are basically aimed at trying to do the very best we can with what we're getting. And what we're getting, like most communities, is far short of the number of people who need the vaccine. Okay. So please know that that's not because we are trying to delay anything or not put resources to it, but we are genuinely torn where we don't, when there is just not enough vaccine and there is this much need and there is this much vaccine, that there will be a bottleneck for the foreseeable future. So please, please, please be patient. I know I'm not telling you anything that's new, but that's important to make a mention right up front. So that's one. With that in mind, however, we are trying very hard to stay in regular touch with the Department of Health, order as much as we can possibly get of doses of the vaccine, and then rapidly turn around and translate that to a process that we can put out, right? So to that end, what we've done is we had started with what the Department of Health at the time called 1A, which is essentially healthcare workers in some way, shape, or form, right? A week or two ago, as most of you know, that got changed to include people everyone above the age of 65 and people between the ages of 16 and 65 with comorbid conditions, a whole list of comorbid conditions. That's what they're now calling the new 1A. So as you might imagine, that suddenly made a large number of people potentially eligible for the vaccine, but there is not enough supply of the vaccine. So what we've been able to do is rapidly try to set up systems to be able to get out to the community with as many people as we can possibly vaccinate. The only problem being, if we don't have vaccine, we can't schedule people. And unlike what some others are doing, what we are not doing is so as to not raise a false sense of comfort that somehow if I'm scheduled for 2 weeks from now, some places are scheduling people without having doses of vaccine. We are only scheduling people when we know that there are dosages of vaccine available to us. Then we schedule the next round and then the next round. So the hope and expectation is that if you are scheduled, that you are highly likely to get the vaccine, other than unforeseen circumstances beyond our control, meaning at the level of either the Department of Health or CDC. So we are currently immunizing 1A, and we have been, based on regular updates to our website, what we've done is we've encouraged people to call and schedule up until now. That process will change because the number of calls we were getting, it was virtually impossible in good faith to respond to all the calls. And they were all genuine calls. There was no way we could respond to them though. So what we've now done is we've set up a system that will start this Friday, the 29th, and that will get to some of the questions I'm seeing floating by right now. That'll get to that, which is that there will be an electronic scheduling process where you can go in, like many, many pharmacies are doing. I'm sure you've seen that on the internet. You can go in and schedule your own appointment. And one of the questions which is appropriate to answer right now is, one of the questions is the logistics. How will you ensure that elderly or disabled persons do not have to, wait in long lines? The way we are trying to do this is in a methodical way so that when you are scheduling an appointment electronically, or right now, not electronically, but by way of a phone through a scheduling process, is you then get an appointment scheduled. You get a time and a place to show up for the appointment. So it's not like a first come, first serve where you have 50 people waiting to get the vaccine, right? It's a scheduled appointment, so it'll prevent those kinds of things. And we have not had that kind of thing at all. Those kind of things that you are seeing on television in some other places where you have these long lines. I don't think that'll happen in our community, only because, or at least at Mount Nittany, the way we've set it up, that it's meant to be scheduled. One of the additional questions related to that I'll address along with this is how can we prioritize within a priority, right? So within 1A, can you prioritize to above 90, above 80? This is worse than that. Unfortunately, we can't. We just can't. Much as we would like to, we can't. There is no good way to do it, short of getting so difficult and cumbersome with the number of people that need vaccinated. Our goal is to get to as many people in the 1A category as we possibly can. And that's the very best we can do, because if we try to do more than that, we will just make it worse for everyone. And that's not what we would like to do. So there is no way to prioritize within a priority, unfortunately.
Yeah, thanks for answering those questions. I just want to go back to 2 points that you raised when you were discussing the distribution, because I think they're important ones. So what makes this situation unique, I think, as a consumer, is that it's good to know that this is not a single dose vaccine, right? You talked about we need to be able to ensure that we have enough quantity before we can schedule folks for this vaccine. And that includes both the first and the second dose of the vaccine, which complicates logistics in some ways, right? Now that could change in the future, but that's where we are now. And the other complicated piece is that this isn't something that we could order up from a distributor. This is something that we request through the Pennsylvania Department of Health, who then determines our quantity. Is that how it works, Dr. Joshi?
Yeah,
When we get the vaccine?
that's exactly how it works. And the problem has been that there has not been a good way to get a sense of how much will become available. Once a week, we get the opportunity to order a certain number of vaccine, and that number is limited and is clearly less than what we would like, right? So
Right.
knowing the population of 1A patients in our community as we speak,
Mhm.
the Department of Health has pretty much said right now, and you will see in both in the national news and in local news, you will see the same thing, which is governors across the country are basically saying, here's my population that needs to be vaccinated, and here is the amount of dose of vaccine. So how do we get everyone vaccinated? And that there's hot political dialogue going on, as most of you know. And one of the things that the president has said in the last couple of days is that he will be increasing, there are negotiations going on that will increase the total amount of vaccine. And our hope, as people on the ground, our hope is that that increased supply reaches each of the states, and each of the states can then put out more vaccines to people like us, and then to people like you, who matters, right? So that's what we're trying to figure out. So currently, unfortunately, the dosages are simply, every week we put in a request, and we get a certain number of vaccines, which is relatively limited.
Got it. Okay. Thank you so much for covering that. Now I think we can turn to some viewer questions. As I mentioned at the top of the broadcast, we received quite a few ahead of today's live session. If you have a question for Dr. Joshi, though, about the COVID-19 vaccine, please go ahead and type it in the comment section below. There are a few live comments that we will address as well. But the first question that we had received prior to the broadcast was this: is it possible to schedule for two people, a couple, at the same time? This person has indicated that they're both over 65 and they'll be coming from a distance, so they'd like to save a trip or two and minimize exposure. What's your best advice there, Dr. Joshi, for how the online scheduling is working with vaccination at Mount Nittany Health?
Yeah, at the current time, we don't have the ability to predictably do that because it's based on availability, right? That being said, if you make an attempt when you're scheduling, try to schedule both back to back, which if they're available, they will be, obviously be together. But there is no good way of saying, I want these two together, and therefore it's 100% possibility that both will be together. But you certainly can give it a try when you do both the appointments to try to schedule them in close proximity. And on our part, realizing that both of you have an appointment, even if it's a little separated, we'll do the very best we can to make it accommodating for you and to help you the very best we can, realizing that many people who are eligible for the vaccine are also people who are inherently frail and weak. So we understand that, and we will do our very best to do the best we can to try to help you.
Absolutely. Great. Thank you. The next question reads, will the second dose vaccine be scheduled when the first dose vaccine is given?
Yes, that is correct. That's exactly how we've done it all along for all the few thousand doses that we've given, including people like us as healthcare professionals, as doctors. When we got our vaccine, when the first dose was given to us, we were given an appointment for the second dose. And that's important, as you might imagine, because not only is the second dose critically important, but also the second dose has to be at a certain time frame, within a certain time frame of the first dose.
Okay, very good. Thank you. Next question for you. Is there any qualifying information yet regarding phase 1B, specifically as it applies to education workers?
Yeah, unfortunately, no, we don't have any more information. It's been 1A itself has been challenging, and I think for a while, I can't certainly speak for the Department of Health, but I suspect one of two things will happen. One is, and I hope this is what happens, which is the supply of vaccine increases, and then it opens up to more people. We will do everything we can if the supply of vaccine increases to to increase our ability to then increase more personnel to be able to make it happen for our community, because that's what is of foremost importance to us.
Absolutely. Thank you. Next question for you. How do I know if I meet the criteria for Group 1A?
Yeah, so what will happen is, as part of the electronic scheduling process, first of all, if you look up the Department of Health website, there is a very nice list. I've been asked this so many times that I haven't printed out here for myself. But as a consumer, you can look at it obviously from the Department of Health, and if in doubt, talk to your primary care provider. Now, once you know that you're eligible, how do we figure out if you are, right? And you will be asked to attest on the request, on the electronic request. It will be asked if why you qualify, why you believe you qualify, and you will then need to put that in.
Okay, very good. Thank you. And for our viewers just tuning in, Dr. Joshi is taking questions that we received ahead of today's live broadcast. If you have a question for him, you can also type it in the comment section below. The website that he just mentioned is mountnittany.org/coronavirus, where we're listing all of the COVID-19 vaccine information that we have available at this time. Another question for you, Dr. Joshi, and it reads, do I need to be a Mount Nittany Health patient to get a vaccine with you?
The answer is no. We've taken the stand that we owe a responsibility to our community, that as the Department of Health and the CDC, in our case, the Department of Health, puts out recommendations, we will do our very best to serve our community, because there is, if we begin to say we'll do this and not that, and this and not that, it'll become a very difficult task for us, which is why we're taking the position that we owe a responsibility to our community, and we'll do the very best we can to vaccinate anyone and everyone who needs the vaccine to the best of our ability.
Okay, very good. Another question, something we've been hearing a lot about, do the current vaccines protect against the COVID-19 variants, those variant strains that have been reported in the media?
Yeah, currently the best that's known is that, and this is, as you might imagine, this is based on biologic plausibility. By that I mean simple logic. It's not based on experience, right? Because there's just not enough experience. So for example, when the UK variant was identified, there has just not been significant enough of a period of time to say vaccine efficacy worked, didn't work, so on and so forth. So the data is very limited. But based on what we in scientific terms call biologic plausibility, which is the logic there that it should work? The answer is yes, it should work. We don't know for sure, and only time will tell. And I really mean that, because when you have more time, you can tell how many people with the variant, for example, got the disease or didn't get the disease, and so on and so forth. But the scientific logic says it should work.
Okay, very good. Next question is related to the vaccine in children. So as we know, the current vaccines that have been approved for emergency use are for those age 16 and over. Have you heard or seen any update regarding a vaccine for those under the age of 16, Dr. Joshi?
Yeah, currently no, and that's fairly typical. What happens is that when new drugs and new pharmaceuticals get tested, they get tested in adults before getting tested in children. I am not aware of data, safety data, and so on in children less than 16 yet.
Okay, very good. Thank you. Who is next in line to be vaccinated? Group 1B. Can you tell us about that category?
Yeah, I'll pick up my cheat sheet right here. It's basically, it's obviously, 1A are people who are high risk, above 65 and comorbid conditions and so on and so forth. Interestingly, very recently, they added smokers to that list, in addition to obviously obesity, chronic diseases, and so on. And 1B gets into a fairly diverse group of individuals that gets into education workers, grocery store workers, as an example, U.S. Postal Service workers. And I won't go through the whole list, but there is, you can look that up on the Department of Health website. But honestly, I think we are a little while away from that, unless vaccine supply increases, like I've said. And that's the key thing. Vaccine supply has to increase to get to the massive numbers of people who need the vaccine.
Okay, Thank you. For those who are eligible to receive a vaccine at Mount Nittany Health, is there any cost to the patient for the vaccine?
No, we are currently not planning to charge any charges for people to get vaccinated at Mount Nittany. So currently there is no charge.
Okay, very good. And then a final question that was submitted before the broadcast is this: why can't I get my vaccine at my doctor's office at this time? And I think we covered this when we talked about distribution, but maybe you can just clarify again for us,
Yeah, no,
Dr.
I think it's a great question. And we hotly debated this when we when we set out to begin vaccination processes. The problem is that unlike vaccines like the flu shot or other vaccines, right? There are, as most of you know, there are unique nuances to storing vaccines, and particularly the Pfizer vaccine, which is very difficult. Storage requirements are hard. Also,
Mhm.
there is a little bit of what's called an economy of scale. So what happens is, in fact, we've had it even though we've clustered people together to be vaccinated in our auditorium, in our other sites, and so on, so that we try to get as many people as we possibly can as we deliver vaccine. And the logic is the following: with when we thaw the vaccine, right, a certain amount of time beyond which that thawed vaccine cannot be put back into the refrigerator. And
Mhm.
once we open a certain vial of the vaccine, then that has to be used within a certain number of hours. So if you imagine, if this was all over the place, if this was in every doctor's office, and there was
Yeah.
only one person on a given day, I don't think that would happen. But if there was a limited number of people, so let's say there are 4 people, and we open a vial that gets to 6 people, and if there are not more, 2 more people, those 2 dosages get wasted. We don't
Mhm.
want to use one single dose of the vaccine, as you might imagine, right? So those are the two logics: storage requirements and the
Mhm.
logistics of the vaccine, the way this is, and the such severe short supply that it's like we don't want to miss a single dose. For those reasons, we decided it was better to give it in situations where everyone knows exactly what they're doing. That's all
Mhm.
that they're doing, and they're going boom, 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 back to back. They're vaccinating as many people as they possibly can. You get a certain
Mhm.
efficiency with that, you get a certain predictability with that, and you get as many people vaccinated as you possibly can, and minimizing, if not eliminating, the chance of vaccine wastage.
Okay, very good. Thank you. Now I think we can turn to questions that were submitted during our session here. I'll go back to the top of the list if that's okay with you, Dr. Joshi, and some of these you already covered. The first question is from Leah, and she's asking about, let's see here, how many slots a day will we have, and will there be evening hours, and when you have sessions on Saturdays? I believe that when you access our online scheduling tool, you'll be able to see what dates and times are available. And as you mentioned, Dr. Joshi, while we hope to plan for some Saturdays, it's really going to be dependent on vaccine supply. Is that right?
Yeah, absolutely. But I think getting to the root of that question, which is, are off hours going to be available? Yes, some off hours will be available, including some weekends. Not every weekend, but some weekends. And in fact, we already did, I think last Saturday is when we did a whole like 500 or 600 vaccinations or whatever. So absolutely, Saturdays some will be made available. And when you go in, one of the additional questions further down was, which is appropriate to answer with this, is
Mhm.
that we will open those slots based on what we have available. So you'll be able to go in, and I would suggest, if you are in line, to go back in and check every day, because things open up, right? And so we will have a certain number based on availability, and then we will continue to just go right through. So you'll be able to see how many slots. And the other question was, how far in advance can I schedule? So right
Mhm.
now, when we're doing this, we're going out as much as we can to ensure that during that time we have the vaccine, right? For sure.
Mhm.
So it'll go up to a certain point. So let's say, please don't hold me to this date, but I'm saying this to make the point. So let's say today we've opened slots until the 25th of February, let's say, but we
Mhm.
get 1,000 doses of vaccine tomorrow. We add those slots right after the 25th. because up until then all the slots are filled, and then we add more slots right after that. So you will see this change by the day as we get more and more vaccine dosages. And I hope and pray that we get more, so we open more slots and get more of you vaccinated sooner.
Yeah. Okay, great. Thank you. Back up to the top here, Linda was asking, what time will the site open for scheduling? So if you go to our website, mountnittany.org/coronavirus, when ready, we will have a large button that says schedule now for those who are eligible to schedule. I don't think we have communicated the exact time that link will launch. I know it's sometime Friday morning, so perhaps we can get back to you, Linda, on that. That's okay. Let's see. Cindy was asking this question. You already answered that, Dr. Joshi. We will also, of course, have access for those with limited mobility. There will be ramps and things like that, so that there won't be any difficulties there. Let's see. Claudia was asking this question about prioritization. We talked about that. About time will the schedule open on Friday? Everybody wants to know. Friday morning, Hope, and we'll get back to you on the details of the exact time. Okay, this person's asking if they have a scheduled appointment and they're unable to keep it, is there a way to notify you? I would say yes. There will be contact information for you, and you'll find that on our website if you need to reschedule. Let's see. Hope was asking, I think we answered most of Hope's questions here. Will the number of appointment slots match the number of vaccines? Absolutely.
I think it's worth just quickly mentioning. I think I've answered this question from Hope, but I'll just reiterate that, which is we've taken the position, Hope, that we are not just randomly scheduling people without vaccine availability, which is why, if you once you do get scheduled, that the odds are extremely high that you would get the vaccine at that time, unlike some other places. Now, that being said, if we suddenly find that we're due to receive 1,000 doses tomorrow and we do not receive them at all, something just unpredictable happens, we'll obviously be back in touch. But we have not had to do this, quite honestly, only because we are scheduling only when we have a certain number available. We're not scheduling before that.
Right. Okay. And then just a final question here from Herschel asking if you've seen any evidence of COVID-19 being linked to pneumonia, if COVID-19 has been linked to lung nodules.
Yeah, so COVID-19 has, Herschel, has led to numerous lung manifestations, and lung nodules are very simply, if you can call it that, they are really a variant of pneumonia in some ways, right? They have other causes as well, but a circumscribed smaller part or smaller area of involvement of the lung compared to larger areas called lobar pneumonia is what a lung nodule is. So when COVID-19 related pneumonia either is occurring right in the early phases or it's resolving, you can see patchy densities in the lung that may look like nodules. And so it's not uncommon to see that. And people are generally recommending to follow them over a period of time to their logical conclusion to see if they resolve or they are resolving. I've seen people and I've seen films of people who they had pretty significant lung disease, and then the lung disease slowly over a period of time begins to resolve through various stages, including lung nodules. So I hope that answers that question for you.
Okay, very good. Well, I think we got through all of our live questions. And that's about all the time that we have for today. Before we go, is there anything you'd like to share with our audience that we didn't cover yet, Dr. Joshi?
No, I think we're good, Leanne. Thank you all for the questions. I just want to reiterate that one thing you can rest assured is that we will try to do everything we can to be transparent, to be honest, to share information that we have. We obviously can't make vaccine available when it's not there, but what we can commit to is keeping you as closely posted as we possibly can. And as we keep getting vaccines, to to continue to take ownership of getting it into the arms of as many people in our community as we possibly can. That's what we're in the business of doing. That's what Mount Nittany is about, and we'll try to do the very best we can. So thank you for your patience. I know it's a very rough time for a lot of you, and which is why the interest, and we very much understand, appreciate, and feel for that interest. So we're trying very hard, and so be patient, and thank you for your patience.
Thank you, Dr. Joshi, for being here once again with all that great information, for taking our questions. And thank you, everyone, for joining us today. For more information on COVID-19, including information on the COVID-19 vaccine, please remember to visit mountnittany.org/coronavirus. Thank you.
Thank you.